being a computer scientist and a mathematician, my first thing I did was attack the data. What's going on? What's going to happen? This is going back into 2017, and you can see the trend. And so, what we really need is a paradigm shift, going from reactive to proactive monitoring. And to do that, you have to tackle a $1 trillion issue that everybody's facing right now. And the way to do that is to do things like shifting to the formula by doing early prevention, creating a virtual circle of people that you trust. It doesn't have to be family. It can be family, it could be friends. It's just people that you trust and that person trusts. And then giving them the tools to be able to monitor themselves, reduce hospitalization through medication. It's not a hardware solution, it's a social engineering solution. If you look at it from a traditional response system, you look at financial burden, it's going to be professional home care nursing, and there's a limit to what you can do. Data privacy concerns, right? You're going to have data used for insurance and it's used for research. A lot of the undeserved population are very perceptive about the fact that they don't know where the data is being consumed, who's using it. If I'm building this correctly, and from again, tech stack up, looking at it from a data architecture and cybersecurity models, how would I do this? You have to have role-based access controls. You have to have very strong access control layers for who can see what, when, where, and why. Just because you're part of a holistic group does not mean that you need to share your own personal information for people who are there to assist. What's the focus that we're trying to help? So we create the whole care narrative in the way that we're looking at. From a virtual circle, the app allows the user to assemble this care group. And inside that, you generate your roles. They're primary caregivers that could pretty much perform everything that the person needs done, create all the tasks, delegate efforts to other people. So it's a centralized, unified dashboard for the family to be able to take care of them. And again, I use the word family, but let's face it, women are living men. They have their own groups. They can generate their own virtual circle, just like anybody from this being the armed forces will decide to do their own. And again, it's about empowering the GPS and tools and services that we already have the devices. There's no additional reason why you have to buy something else. Just leverage everything that you have so we can use as many features as possible. If you have a watch, we can track your vitals. Now we're doing threshold monitoring for those vitals. It only goes to primary caregivers and so forth.